Good morning, good afternoon, and good evening, everyone. My name is Michelle Dynes. I am an immunization demand specialist from UNICEF's East Asia and Pacific Regional Office. I'm really happy to be here today to talk about individual and interpersonal level interventions and strategies. We're going to talk about the learning objectives, some simple definitions, then a range of strategies to help increase COVID-19 vaccine confidence and demand. We're going to talk a lot about interpersonal communication for immunization, which is also known as IPCI. And then I'm going to provide a bit of an introduction to motivational interviewing, also known as MI. So here are learning objectives. You should be able to review definitions and basic concepts around strategies to generate demand. You should be able to describe 12 strategies for COVID-19 vaccination uptake. You should be able to describe principles of effective interpersonal communication for immunization and explain the steps to apply a rapid motivational interviewing techniques for COVID-19 vaccination. So here are some simple definitions. Interpersonal communication is the process of exchanging information, ideas, thoughts, and feelings between a group of two or more people using verbal and nonverbal messages. We often focus on verbal messages, but nonverbal can be just as important. And nonverbal communication is a way of transmitting information to convey thoughts and feelings through actions. And so this can be body language, gestures, facial expressions, or other sounds that aren't quite words. And these can help to strengthen what you're saying, but they can also contradict what is being expressed verbally. And then finally, empathy and sympathy. Empathy is the ability to understand and share the feelings of another person, whereas sympathy is having feelings of pity or sorrow for someone else's experience. And really, we want to get to a place of empathy in order to have positive interpersonal communication. So here's our problem statement. Negative interpersonal interactions between healthcare workers and clients can reduce the community's trust in healthcare workers and trust in the health system more broadly. It can also reduce the community's desire and likelihood to follow recommendations from healthcare workers and reduce the chance that they're going to return for future services. So let's begin by talking about strategies to help increase COVID-19 vaccine confidence and demand. From the perspective of convenience, anytime we can make it easier for people to get vaccinated, we can increase the chance that they will do that. So this could be in schools, in the workplace, just anything that makes it easier. Trusted sources are incredibly important for vaccination. Provider recommendation, vaccine ambassadors, those can be individuals who are highly regarded in a community or across a country. And also messages from trusted messengers. And these might be community leaders, social media, influencers, etc. Then there are structural processes that can be used. One example of that is using vaccination as the default versus non-vaccination as a default. So this is where you would have people opt out of getting vaccinated instead of having them opt in. So it's straightforward for them to get vaccinated and they have to do a few extra steps to not get vaccinated, and that can help. Communication channels, examples of this might be reminders through SMS or email, or something we would call a nudge, something just to remind people and nudge them forward to getting vaccinated. Communication also is really important around misinformation. So you have to combat that by providing the correct information, sending people to the right resources where the information is from trusted places. And then finally, motivation. Motivational interviewing is something we'll talk about later in this presentation. Incentives can be particularly helpful with certain age groups. And vaccine requirements might be useful in situations where someone needs to be vaccinated to fulfill work duties, to go to places that they enjoy going to. And that's just one strategy for increasing demand. Now let's move on to principles of effective interpersonal communication. So these principles are not complicated. It's the way we all would like to be treated and interacted with in an interpersonal setting. The first one is always welcome the client in a warm way. So usually that means with a smile, never looking rushed. Number two, always want to have discussions from a place of empathy, and always demonstrating that you understand the perspective that they are coming from. Keep messages simple and clear using local language, and avoid making assumptions about whether they will accept or be hesitant for vaccination. Number five, listen actively. And that really helps to encourage further discussion. And that further discussion will help you to better understand why they might have those hesitant feelings. And number six, it's useful at the end of a discussion to check their understanding of the information you provided, to make sure that they integrated that information in a way that is accurate. And one more set here of principles for good IPCI. Be polite even when you disagree with the client. That can be the hardest time to have a good level of politeness, but that's when it's most important. Being polite will set the stage for a good, respectful engagement between the healthcare worker and the client. You want to encourage clients to express their ideas and fears, and you can show appreciation for them when they share their knowledge and when they ask questions, because that shows that they've been really thinking about these issues and that they feel comfortable to bring those questions to you. Always want to avoid interrupting clients when they're speaking, just because we know that that conveys a level of disrespect in communication. Number five, you want to use appropriate body language, expressions, and eye contact for the context. And this is especially important when it's a cross-cultural interaction. You want to know what is culturally appropriate before you have those interactions. And then finally, use respectful terms of address. And that's going to vary from location to location, but know the right words to use to make people feel comfortable and respected. So let's move on from IPCI to motivational interviewing. This is really a very specific way of talking to clients who might be hesitant. And this can be done in a very rapid way, taking up as little as 1 to 5 minutes during a healthcare worker client interaction. So step one is to embrace an attitude of empathy and collaboration. Step two is to ask permission to discuss vaccines. And this shows that you're respecting them and that if they don't want to discuss it, then that's okay as well. Step three is using those motivational interviewing techniques to better understand the client. And then step four, give them the chance to ask questions that they have. So let's take a look at each of these steps. Always be compassionate, show empathy, and be genuinely curious about the reasons that they might be hesitant. That curiosity can be put in place of any kind of frustration you might feel as a healthcare worker, any anger you might feel at a client not wanting to follow your recommendation. Go from anger to curiosity, and that's going to really help the communication improve. Always be sensitive to cultural and family dynamics that might be influencing their perceptions around vaccines. And it's really important to remember that arguing and debating is just not going to be useful in that interpersonal communication. That is only going to make the divide kind of between healthcare worker and client even wider, and it's going to make it much less likely that the client's going to be receptive to the information you have. So don't take a strong initial stance, but step back and show curiosity and interest in their perspective. Step 2 is to ask permission to discuss vaccines. If they say no right off the bat, you have two options. First, you can say, I respect that because I care about your overall health, and maybe we can talk about vaccines at a time in the future. Now, if you get a sense that their worldview and values might be open to vaccines, you could spend a few minutes exploring why they don't want to talk about it. But the goal is not to change their mind, it's really to understand their perspective better. Now, if you ask permission to discuss vaccines and they say yes, then you can move on to step 3. So step 3 is using those motivational interviewing techniques. Ask them on a scale of 1 to 10, how likely are you to get a COVID-19 vaccine? And it's really interesting, but you want to explore both sides of the number that they give. So for example, if they said 4, you would say, okay, why a 4? Tell me why you said a 4 and not a 3. What are the reasons you do think you would get a vaccine? People who are hesitant usually have much more experience explaining why they haven't taken the vaccine. And asking them to express the reasons why they might get vaccinated can help them process their choices and think through that option more clearly. Always be compassionate and show curiosity about their feelings. You want to support them, help them to incorporate their own personal values and the health needs of their family more broadly, and even their community. And that can help them to make a decision. And then finally, respond to any questions that they have about vaccines and other health issues. If you don't know the answers to their questions, make sure you help to refer them to the correct people who can help answer their questions. And that can be websites, trusted sources, or individuals in their community. Here's a quick example of interpersonal and individual type of interventions that was recently done in Ethiopia. They did a human-centered design project and came up with some ideas at the community level for how to increase vaccine uptake. One idea they had was to provide an Employee of the Month award for healthcare workers who had positive and welcoming attitudes towards their clients. And so that's a way to motivate healthcare workers to have those really positive interactions with the community. Other ideas revolved around ceremonies to acknowledge families who were fully vaccinated, and having larger dialogues with different groups in the community, like women's groups or leaders in the community, can also be really effective. So those are just some simple examples that come from Ethiopia, but might be something useful, in a wide range of settings. So we were asked to share 3 truths about the problem, and our problem was negative healthcare worker and client interactions in the field. So what are 3 truths I'd want you to know? Healthcare workers are still the most trusted source of information for vaccination. I think sometimes we forget that, and we don't give healthcare workers, the respect that they deserve for being those trusted sources. The quality of interactions between healthcare workers and clients is a key factor in uptake of vaccination. And we want to remember, even if community members come for vaccination, if it's a negative experience, they're very unlikely to return for the next dose or the booster dose in the future. And then 3, I think it's important to acknowledge that healthcare workers want to provide high quality care, and that includes having respectful interpersonal communication. However, the reality is that service environments and the limited number of healthcare workers are often barriers for them to achieve that high quality care and interpersonal interactions. So what are the best practices that we can use to combat those barriers? In terms of doing IPCI and motivational interviewing training for healthcare workers, I want to stress the importance of giving them the opportunity to practice those skills. So role playing can be really helpful to get healthcare workers more comfortable with that interaction style. They may be very used to communicating in very different ways, and giving them the chance to practice over and over the way to communicate in a respectful and empathetic way can be really helpful. Number 2, key elements of IPCI and motivational interviewing should be integrated into healthcare workers' scopes of work and into supervisory visits and performance evaluations. This helps healthcare workers to realize how important this aspect of their job is. It's not just seeing patients and the number of patients seen, but it's the quality of that interaction that really matters as well. And then number 3, it's really important that these types of interventions for IPCI and motivational interviewing are coupled with activities that address issues of the workplace. And that can be work-life balance issues, unsupportive environments, etc. We cannot only do IPCI training, but we need to make sure they are functioning in an environment that supports them. So here are a few metrics and evaluation activities for IPCI and motivational interviewing. I'll just give you a couple examples. For healthcare workers, you can look at their knowledge on how to engage with good interpersonal communication and motivational interviewing. For clients, certainly client satisfaction with those interactions is really critical. And then other examples might be, how many facilities have we implemented IPCI and motivational interviewing? How many supportive supervision visits have we used to help support healthcare workers? So here are some actions or interventions that can help to reduce negative healthcare worker and client interactions. Now, if we're looking at the basic model here, the mountain bike model, where we don't have a lot of financial resources, you would consider integrating supportive supervision sessions where you can do some role play practice for IPCI and motivational interviewing techniques. You can also introduce a comment box for facilities so that clients have the chance to provide feedback, both positive and negative. Now, if your resources are a little bit higher and we look at the sturdy 4x4 version, you can do those same mountain bike version interventions, but add some additional elements, such as weekly SMS for healthcare workers to share tips on how to positively engage with vaccine hesitant clients. You can do observational, you can observe healthcare worker and client interactions using checklists of IPCI and motivational interviewing techniques. And then one more creative way is to use a contest among healthcare workers on innovative ideas for how to make clients feel more comfortable so that they can ask questions and feel like it's okay to share their concerns. And then finally, if you really have a lot of funding and support, you can consider doing national surveys on client and healthcare worker experiences and doing those multiple times over time to see if your interventions are working. You can integrate focal points on IPCI and motivational interviewing into the ministries of health, and they can help be master trainers for cascading the training down to local levels. You want to make sure that healthcare workers have access to trainings, either virtually or in person, and integrate that into pre-service training so that healthcare workers come into the field with those skills already developed. Other areas that are important is to make sure there are enough human resources, because we know that if healthcare workers are overwhelmed, they just do not have time to integrate IPCI and motivational interviewing into their daily interactions with clients. And then finally, always couple these interventions with interventions that will help to improve their work-life balance of healthcare workers and make sure the workplace environment is supportive of these activities. So here are a few resources that I want to share with you. UNICEF has an interpersonal communication for immunization manual. The American Pediatric Association and CDC have come out with an introduction to motivational interviewing for healthcare professionals that I think is really useful. In the WHO, Open WHO platform, there is a module on communicating with the community about COVID-19 vaccination. And the field guide for COVID-19 vaccination provides those 12 strategies that we discussed in increasing demand for vaccines. And then finally, a recent resource for you is the Human-Centered Design for Tailoring Immunization Programs, which was co-developed between WHO and UNICEF. I hope that these resources will come in handy to you and that you'll be able to integrate some of these ideas into your work in the future. Thank you for your attention, and I hope that you have a great rest of your day.